We have a fact check on the Wellness Files today. Obesity rates are decreasing. According to the Gallup National Health and Wellness Being Index, rates hit a high of 40% in 2022. Now they've dropped to 37%. Now this might sound small, but that is a difference of 7.6 million people. Researchers say this is largely due to weight loss medications known as GLP-1s. The White House just announced patients will be able to get these medications for $350 a month starting next year. Normally, Ozempic or Wegovy costs around $1,000 a month out of pocket. But there are a lot of things that you need to know if you're considering taking these medications or if you're already on them. So I'm here with triple board certified Dr. Nita Bijoor. You're also board certified in obesity medicine and lifestyle medicine.
That's
so
correct.
I knew it'd be great to talk to you about this topic. Let's first go over why is it important to pay attention to what we're eating and exercise. Let's start with what we're eating.
So what we're finding is these GLP medications, they shouldn't just be a quick fix. You want to really have long-lasting results, and it's in a really exciting time right now. If we incorporate healthy eating along with good movement and consistent routines, I think we can really have long-term weight loss and lifestyle gain. So that's what it's about. It's not just about losing weight, but right now with a good healthy diet with nutrient-dense foods and really incorporating high amounts of protein, you can get really good results long-term.
Have you had any patients who are nutrient deficient because of these medications?
Oh, absolutely, because what they do is they cut your appetite, so you don't feel hungry, and if you're not careful, you can actually lose electrolytes, you can get dehydrated, you can get dizzy. I've had patients that have taken it from online pharmacies and just not had any close follow-up, and so that has led to a lot of issues. It's all about understanding what the medicines do and really using it as part of your long-term lifestyle approach. But we've seen a lot of other side effects too if they're not taken correctly.
I actually interviewed a patient once who said she often got dehydrated because she would get full so quickly, and then she would forget to drink anything. And so she had to incorporate electrolytes and just remind herself to drink more water because her stomach basically shrunk after taking these medications. So that's good to know. What about exercise? I know that we actually lose some muscle as we lose weight. So can you talk about that?
So the loss of muscle mass is pretty significant. It's called sarcopenia. You can lose bone strength, muscle strength, just feel weak. And if you're not careful with that, it can really cause long-term fatigue and just lack of endurance, lack of fitness overall. So I think just incorporating movement and resistance training. We have patients will say, oh, I walk every day at work. That's fine. But unless you exercise your muscles, strength training, stretch exercises, those will really improve your muscle tone and muscle flexibility, and that actually determines your basal metabolic rate. So your BMR, the rate at which you burn calories, is determined by your muscle mass. So the more muscle mass you have, you actually keep fat away and you can build up muscle and have, when we talk about longevity, that's really what it's about, keeping your muscles strong and healthy.
And one last question, for those who might have had some of the bad side effects, I know there's stomach paralysis, things like that. Any tips on how to mitigate that? Yeah,
so there are a few really important rules to follow. So you want to eat small portions, but nutrient-dense portions. So don't load up on fried foods and high-fat foods in the beginning, because you'll feel really nausea and vomiting and bloating are really, I tell my patients, they're not just side effects, they're expected results. You can't eat like you did in the past. You have these meds, they're slowing your stomach down intentionally. So you want to be really careful with small portions. Also hydrate a lot, because water makes a big difference. When your cells are hydrated, you actually burn, your metabolism is better for you. And then also constipation. If you're prone to constipation, seek your physician's help. Really use it as part of a comprehensive personalized care program. It's not just take the meds and see you. It's really about understanding that it's part of your whole health plan for you. So I think that's made it really effective. It's an exciting time. I've seen great results. I've used them. These meds are not new. They've been around for 20 years for diabetes. Now we're using them for obesity and longer acting ones, once a week formulation. So now we're seeing patients not just lose weight, but get healthy, reverse their diabetes, and really, just empowering to patients. It's a wonderful time to see.
All right. Well, thank you so much for joining us today, and we'll keep all of that in mind.
Okay.
Thank you.
Thank you.